Good morning, everybody. My name is Dr. Asa Frey from Clínica Back to the Garden. We are the only center in Latin America which has a specific residential center for supervising physician-supervised water-only fasting. We have patients that come from all over the beautiful island of Puerto Rico, but we also have lots of patients from Mexico and Latin America and the East Coast of the United States. So if you want to do a fast, please think about coming down here to Puerto Rico and doing one. Today we're going to talk about fasting. This is the third part of a 3-part series that I've been doing over the past couple weeks. And today we're going to talk more about how fasting changes the way that we think. Okay? We can change our mentality, change our focus, change our priorities, gain control, clarity, become aware and conscious of our health. Fasting can be used to literally recreate your relationship with yourself. Fasting can be the bridge towards consciousness, presence, peace, awareness, not just concerning your health, right, but concerning your life and how you live it, how you perceive and interact with the world. Again, if you haven't met me before, my name is Dr. Asa Frey. I am a co-founder and co-director of Clínica Back to the Garden, which is a center for health and education on the beautiful island of Puerto Rico in San Juan. Hola Marina, Van Balen, Juana Victoria, how are you guys? Give me a thumbs up, let me know where you're from, send me a wave or a wow face or a heart, whatever you want. But let me know that you guys can hear me okay. And we are about to begin. So we talked, well actually let me do a couple announcements first. In a few weeks in Ohio, Dr. Joanna and myself will be traveling to Ohio, Cleveland, Ohio, for the annual National Health Association Conference. This is a conference where some of the elite speakers and healthful living practitioners get together and give a conference. Some incredible idols of mine, Dr. Joel Furman, Dr. Joel Kahn, Dr. Pam Popper, Dr. Frank Sabatino, of course, Dr. Alan Goldhammer, Dr. Anthony Lim, Dr. Gracie Yuen. We have an incredible lineup out there. So if you guys are interested in attending that conference, it's a 3-day conference, I believe. We'll be getting there on Thursday night. We give, I think we'll be giving a Q&A on Thursday night, and then I have a lecture on Saturday going over the hidden benefits of fasting. And Dr. Joanna is going to go over how to raise healthy children, and that will be on Sunday. If you guys are interested in that, please visit, I believe it's healthsciences.org, or look up the National Health Association on Google, and you'll find their website. The president of the association, I believe, is Dr. Mark Huberman. All right, so get in contact with him if you guys want to go to Cleveland in a couple weeks and hear just a bunch of incredible speakers and really the top practitioners of these healthful living principles really in the world. So, what we're going to talk about today, right? We've already talked about acceptance. We've talked about accepting, number one, that you should be doing a fast, the necessity for a fast, whatever benefits that you want to get out of it. There are just a million benefits that you can gain from doing a fast. Physiologically, physically, health-wise, but also, mental health-wise, spiritual health, psychological health. Then we talked about surrendering, right? We talked about surrendering your life from beforehand in order to take a break, a much needed break, in order to do a fast and begin from zero and start successfully changing and maintaining some of these habits that you're going to adopt. Because of course we're fasting in order to improve our health and then continue after the fast, maintaining and improving our health from there on. And we expect our patients to continue getting better when they leave. And so the education program that we have is there in order for people to learn how and what exactly they need to be doing to maintain a healthy body and a healthy mind. So the third thing we're going to talk about is presence. Is presence. People call it mindfulness, but a better word, I think, is presence. Actually being present in the moment where you are right now, in the situation that is happening right now. Because that's really all there is. That's where all your power is right now. It's not yesterday. It's not in, that situation that you had yesterday with the coworker that is super annoying and he said something ridiculous. That's not where your power is. So if you're thinking about that, you're essentially draining your energy and your time in the past. And worrying about the future, the future is something that is unknown. It's not something that we can predict. It's not something that you can manipulate. It's not something that you can, actively live in. So worrying about the challenges that you have tomorrow, probably not something that you want to be focused on if you're planning on living a really happy and vibrant and healthy life. So today we're going to talk about presence. Fasting teaches you presence, which is awareness of the present moment. Now, I gave the example in my first live, which was a couple weeks ago, about your morning routine and how you get up in the morning and maybe the first thing you do is go to the bathroom and then you begin to brush your teeth, right? And you brush your teeth and all of a sudden you start thinking about something else. You're not actually concentrated on brushing your teeth correctly, right? You're thinking about something else. You begin thinking about, whatever it is you need to do that day. Maybe something you forgot to do the day before. Maybe you're thinking about something that you need to do in the future. Or maybe you're worrying about something that's going to happen during the day or doing this compulsive planning that we all do in the morning. And I'm not picking anyone out. I do this all the time. So you're brushing your teeth and a thought comes into your head and then you begin thinking and that stream of thinking continues and you take a shower and you get dressed and you get in your car and you drive your car all the way to work and then you get out of your car and you realize for about 3 hours during the morning you weren't really paying attention at all to what is actually happening in the present moment. Now that is a huge problem, and it makes it very hard for people to make informed, aware health decisions. So it's very hard to be aware of what decisions you're making for your health and for your life and for your happiness and for your peace when you're not actually present, living in the present situation. So the example I'm going to use, there are just so many examples where fasting gives us, kind of gently forces us into presence, okay? The first is a concept, it's not a concept. People get symptoms during a fast, right? We all get different types of symptoms, and many of these symptoms are completely normal. You get nauseous, maybe you have a headache, your breath starts to smell terrible, maybe your body odor. You lose a lot of weight, about 1 pound per day. Some other symptoms include vomiting and orthostatic hypotension, which is lightheadedness. Okay, orthostatic hypotension is a very simple concept. It's ortho, which means straight, static, which means not moving anywhere, and hypotension, which is where the blood pressure gets low. This happens to pretty much everyone during a fast. I'd say about 49 out of 50 people during a fast experience orthostatic hypotension during a fast. They get up too quickly or they sit up too quickly and the blood from their head, because the volume of blood is less than it normally is when you're not eating food or taking in any new minerals, then you start getting rid of sodium and water and a lot of other fluid that comes along with that. That's inflammation and edema and lymphatic fluid and many other different types of humors or fluids. So the volume inside the arteries is a little bit less. And so when you raise yourself up too quickly, sometimes the blood will pool in the legs and you will get dizzy, right? Because there's not enough oxygen getting to the brain. This is perfectly normal. It's exactly what's supposed to happen. Your body is very intelligent. It's doing exactly what it's supposed to do. And so these symptoms encourage you to lay back down. Okay? You get dizzy and immediately your body says, okay, well, get as close to the floor as you can in order to put the brain back at level with the heart so the heart can pump more efficiently and bring blood back to the brain. Now, during a fast, this is more or less what's going to happen. At some point during a fast, you'll get up in bed. And of course, weakness is very common during a fast. So you get up very slowly in bed and you think to yourself, I need to go to the bathroom, right? Now is the time that I'm going to make my journey to the bathroom, my adventure to the bathroom. Because during a fast, that is kind of an adventure, going from your bed to the bathroom. And you stand up, right? You stand up and you take 1 or 2 steps and you think, okay, this is going fine. And as you take 3 or 4 steps, you find yourself bending over and putting your hands on the floor and getting closer and closer to the floor. And eventually, you lie down on your back and you flip over and you look at the ceiling. And you bring your knees up and you start to feel a little bit better, right? The lightheadedness disappears, your vision clears, your vision comes back. And you're looking up at the ceiling and you think to yourself, wow, this really feels good. Right? I feel great on this floor. Maybe you touch the floor, it's kind of cold. Ooh, this feels kind of nice here. You take a deep breath in, you start to feel a little bit better. Maybe you hear the fan. You hear the fan whirring, right? And you feel the breeze coming from the fan and you think, oh, how wonderful fans are. Whoever invented fans, what an incredible person, what an incredible thing that we have here, these fans that just bring the breeze when there is no breeze. Maybe you look at the ceiling and there's a pattern on the ceiling, maybe a spackle pattern on the ceiling, and you think how beautiful that is. Isn't that fantastic? Somebody must have done that. Somebody must have spent a lot of time doing that. Maybe you smell something. Maybe you smell... at our fasting center, usually when they're smelling something, they're smelling, Dr. and Dr. Frey cooking dinner, right? So maybe they smell something coming from our kitchen. Maybe we're making granola, right? And you can smell the pineapple juice that we're using to sweeten up the granola. You say, oh, that smells delicious. That's pineapple juice. I know that's pineapple juice. That smells incredible. Are you guys following me? Is everybody following me? Give me a thumbs up if you can hear me, okay? And if you guys have questions about fasting or about eating a healthy diet or living a healthy lifestyle, anything at all, just throw them out there. I'll try to answer them as best as we can. So you're on the floor after having experienced your episode of orthostatic hypotension. And you come back to life, right? And you start noticing things that you wouldn't have noticed before because you weren't paying attention. You notice the fan, you notice the smell, you notice what you're looking at, you notice how you feel, you notice how you're breathing, you notice how your stomach feels, you notice how happy and content you are lying there on the floor. And you think, wow, how did I get here? How did I get here on the floor? Oh yeah, that's right. That's right, I had dizziness. And the doctors told me that was orthostatic hypotension, and immediately I should lie down on the floor, and I did. I lied down on the floor, I turned on my back, I pulled my knees up, and now I feel so much better. Wow, my body is so intelligent. You start thinking some positive things about your body. Oh, how intelligent my body is. That it had the presence to do that, the instinct to do that, and I allowed that to happen. I was actually present for the health, the experience of health. The conversation you have with yourself starts to shift from thinking about the future or remembering or brooding or obsessing over the past to the now. You actually become present. This is an incredible concept, right? You're actually thinking, oh wow, I'm weak. Right? I'm weak. I don't have the energy to do things like I would normally do them. I have to take a step back. Right? I have to slow down. Hola Zaida Ortiz, how are you? Hola Victor Toledo. Right? You start, the conversation that you are having with yourself completely changes. And you start actually being present for the experience of health and noticing what's happening to you. You think, oh, wow, now I'm weak. Right? I really can't do things the way that I used to do them. I have to, do everything with intention. I have to put all this intention behind everything that I do now because I'm fasting. I have to walk a little bit slower. I have to get up a little bit slower. I can't run to the bathroom, right? I have to move and do things and think slower. Good morning, Teresa Lugo Medina. How are you? Welcome. Bienvenida. So, there are so many instances where you experience this during a fast. Not only is there orthostatic hypotension, but many people experience things like nausea and headaches, right? And gastrointestinal reflux. They have reflux and burning in their esophagus and in their chest. And really, there's not a whole lot to do, right? There's really nothing to do. You actually get to allow yourself the experience of those symptoms, right? There are no remedies. You really need to surrender your remedies during a fast. There are no essential oils or pills or potions or powders or enemas or treatments or pain-relieving medications during a fast, because nothing can really improve the fasting experience. You either do it or you don't do it. You either take the time to get well or you don't take the time to get well. But when you break your fast, and you take that first piece of fruit, that first slice of watermelon, that first piece of celery, the first slice of cucumber, or maybe it's a juice, right? Maybe it's a fruit and vegetable juice. Maybe it's that apple celery juice. You take that first sip of juice or that first bite of mango, and the experience is truly about you. It's all about you. We tend to put others first, right? We tend, especially if we have kids, we tend to put others first, and we relegate ourselves or neglect ourselves until later, especially if you're a parent. We have a child, his name is Asher, and he eats an incredibly healthy diet, and we facilitate that by making sure that he has the vegetables that he likes to eat on the table. He likes asparagus and broccoli and cauliflower and carrots. No onions, don't feed him onions, he will not eat them. Sometimes he likes mushrooms. He likes chard and kale and spinach. Right? He has a whole list of vegetables that he does like to eat, and so we make sure that we make food for him. Now, I really don't think about myself usually when we're making dinner, right? I usually never get to think, wow, what would I like to eat? What is going to taste good to me tonight? Because usually I'm just eating whatever Asher doesn't eat. We make a whole bunch of fruits and vegetables and some starch, and really whatever everyone else doesn't eat is what I'm going to eat for dinner. And of course, after dinner, after Asher's done with dinner, he goes and he plays, and inevitably he's going to come back to the dinner table and he's going to ask me to play with him. He's going to say, Dad, I'm in my room, I'm building this tower, I have this awesome tower I'm building, and I'm putting Legos on top of the tower, but it's too tall, and I need your help. And, I'm going to say, but Asher, I'm eating dinner. I'm eating dinner, Asher. And he'll say, yeah, but that's not really so important. What's important is that you come and help me, right? Is that you come and help me now, and it's just going to take a minute. We'll just take a second. Come on, let's go. And I always end up saying, okay. I say, okay, let's go. And I relegate myself and neglect myself until later, right? Until I have the time enough and sort of a more tranquil environment for me to eat my dinner in peace. Just an example, many other wives and husbands put other family members first. Maybe it's your wife and your kid and your mother and your father, and then you have to feed the dog, right? You take care of the dog, and then after that, you take care of yourself, right? We're usually last on the list. And as you begin eating food again, tasting everything again for the first time, you say, wow, this is a mango? This is how a mango is supposed to taste? That's incredible, right? What an incredible fruit that is. Such an incredible fruit. I could eat this fruit every day. Or you think, wow, this is a tomato. These are tomatoes. Tomatoes are salty and they're sweet. I could never taste that before, but now they're delicious, right? I could eat tomatoes every day. What about celery? Celery is a very salty food. It's very high in sodium. Wow, isn't that weird? Celery is salty. We just had a patient break their fast today with an apple and celery juice. She drank about half of it, and then after that she said, you know what? I can't really finish the juice. It's too salty. It's too salty. Her taste buds are that sensitive to the sodium that it's too salty for her. And you start to notice these things. Maybe you think, wow, I eat really fast. Maybe you think, wow, I ate my meal in 10 minutes. And that's kind of fast. Maybe I should slow down and actually take the time to chew my food, because we actually have the time enough to be present and experience eating a meal. The fast allows you to awaken to things that were always there, but you couldn't see them because you were never really present enough to notice. Chewing your food, taking time for meals. Maybe you think, wow, I don't have to make complicated meals. I just ate a meal of celery and cucumbers and watermelon, and you know what? I'm full and I'm satisfied and I'm not hungry. Maybe I don't have to make complicated meals. Maybe I don't have to eat that much. Maybe I don't require so much food. So this gets easier and easier to think about doing after your fast. Maybe you think, wow, this is pretty easy. I don't need recipes, right? I don't need a recipe to remember how to peel a banana or to cut a watermelon or to cut up a pineapple or to cut papaya or to wash my lettuce and my spinach and eat it. Maybe I don't need to make, all these different recipes. Maybe I don't need a huge recipe book. Maybe I don't need all the 10, 20 vegan recipe books that I have right now. Maybe I can just eat very simple meals. Maybe you think, well, I like taking time for myself. During a fast, there's lots of time for you, right? To be with yourself. Maybe you think, wow, I really love spending time and having time enough for myself. I enjoy sleeping enough. I enjoy sleeping enough time for me to recover and feel great and have lots of energy and feel good all through the day. Maybe you think, wow, I can do this by myself. I can do it by myself. I don't need a supportive husband. I don't need a supportive wife. I don't need children who eat what I cook. I don't need children who eat their vegetables, right? Maybe that's not that important. Maybe I can do it by myself. Wow, look at all these new skills that I have now. Look at all the things that I have accomplished, right? I know that I can do it. I know what to do. I know how to do it. And it's because I took the time enough to be present and to do some education to recover my health. And now that I have recovered my health, now it looks pretty easy. It seems pretty easy. I think that I can do this. Maybe you think, well, and even if I can't do it, even if I might screw it up, I know what I need to do. I know what I need to do to fix it. I know what I need to do to get back on track. Maybe you think, well, I can always come back and do another short or long fast and continue practicing until I become a master. That's what you want. You want to become a master. And it takes time and it takes practice. But you can always come back and do a fast. Maybe you think, you know what? I should do a fast every year. This is a great thing for me to do every year, to take a really small amount of time, in the 52 weeks of the year, in the 365 days of the year, over a period of 40 or 50 or 60 years, however old you are, you finally took a week or two or maybe 3, just 21 days for yourself. Incredible. Only during a fast can you experience what it truly means to listen to the body, because you allowed yourself to be present for the experience of health. And from that short period of presence during a fast, you will learn that there is no more powerful place than the present moment. There is nothing more powerful than the present moment. Not only will you be more conscious of food choices and sleeping habits and eating a healthy diet, but conscious and aware of when you're not present. That's important. Being aware of when you're not present and when you're trapped in your compulsively thinking mind. Maybe what is truly important becomes clear. Maybe for the first time ever in your life, you actually become a priority in your own life. Thinking about what state of health you want, what state of being you want. What do you want your life to look like? What do you want your life to feel like? You spend more energy focusing on the things that you desire more of in your life and less time in an unconscious state of being, just reacting to what life presents to you, right? Here, Asa, here's what life has for you today. How are you going to react to this? That's really not how you want to live your life. You want to live your life creating the happiness and the peace and the joy and the excitement and the adventure. You actually want to create that for yourself and not be left to react to whatever happens. Remember, happiness and peace are found in the journey, right? In the journey, in the experience, in the epic adventure. That's where you find the peace and the happiness and the joy and the excitement. It's not in the finish line, right? It's not at the end. It's not when you get to the top of the mountain. It's during the climb, right? You could easily just have somebody put you in a helicopter and fly you to the top of the mountain and then get off at the top of the mountain, but that's not very exciting, is it? Yes, there's a view up there, but you're not going to get that satisfaction and find that contentment and happiness and joy. You'll find it in the journey. I have seen during a fast on a consistent basis, not only sick people get well, right? It's great to see sick people get well. We love that. We love to see people drop weight and people's skin clear up and their psoriasis go away and their joints feel better and their arthritis go away. The inflammation in their tissues and in their joints leave the body. We love to see people with autoimmune conditions stop their reactions and start reversing those autoimmune conditions. We love to see tumors and myomas and fibroids and cysts. We love to see those decrease. There are so many conditions that benefit physically from doing a fast. So not only sick people get well, but mean people turn nice. After about, you take the most angry, cranky, craggedy person who's just complaining and unhappy about everything, and you put them on a fast, and after about 7 or 10 days, that person is going to be an absolute angel. An angel. appreciative and with gratitude and thinking about positive things in their life and the things that they have and the things that they want, that person's going to completely change. I've also seen selfish people gain empathy. Corrupt people turn honorable. Self-deprecating gain self-respect. The helpless empowered. The weak strengthened. The lost gain clarity. And all by doing nothing intelligently, which is what a supervised water-only fast is. Doing nothing intelligently. So that's about all we have for today. Next week, I'm planning on doing another live, but really I haven't thought about what to do it on. We can talk about fasting. We can talk about what are the normal symptoms of fasting and why do you get those symptoms. I often get questions about that. Why do I get a headache during a fast? Why am I nauseous? Why do I have orthostatic hypotension? Why do people sometimes vomit during fasts? Why do I get bad breath? Why do I get nausea? Right? Why do we get reflux? There's a list of very, very common symptoms that happen during fasting. If you guys want to hear about that, I could definitely talk about that next week. But I'll think of some other topics and throw them out there. If you guys have some things that you would like me to talk about, a common question is, can I fast on my own? How long is it safe for me to fast on my own at home without proper, experienced, direct supervision? And we can certainly talk about that. How often can you fast? That's a great question. That will take me about maybe 10-15 minutes. Short answer, you can probably fast every few months, but that depends on the length of your fast. But that's a great topic. Nancy Perez Torres, thank you for putting that out there. I can definitely talk about that next week on Monday. Does anybody have any other questions? I'm going to roll through these really quickly, see what we got here. You're welcome. Mariana Quinones, hello, how are you? I hope you're well. Good to see you. What else we got? Not so much. Just a lot of appreciation. Well, thank you for your appreciation. I like to do these for free every week so that you guys can get some education. You're welcome, Nancy. And we will see you guys next week, okay? This video is going to stay up, so if you guys think about other things that you would like me to talk about, just put it up there, okay? Hola, Gladys. How are you? Bye-bye, guys.